if any of them went to the toilet to pass water. And I also want to ask you people of the media, if you have not passed water since you woke up, then you should come to my clinic, because then it means you are not well. So what the government wants is to ensure that children are skilled in work that they are going to do, which everybody is doing. Like everybody goes to the toilet. When you go to the toilet, you look at the walls, you look at the floor, you look at the toilet itself, you find out whether water is running. That is the basis upon which TVET institutions are being elevated. The issues of water stress in this country, how you conserve water, the quality of buildings. Just recently there's a building that collapsed in Kericho, and it is purely because we have not been doing what we are supposed to do. The simple matter of having the concrete being mixed in proper proportions and being tested like they used to do in small, and then saying, now this will withstand this stress. So that's what we are supposed to be teaching these children. And the TVET institutions of tomorrow must do so. And we have followed suit with the CBET curriculum, which I believe is now in an advanced stage. The government on its part has continued to employ and empower the faculty in TVET institutions. I think the last lot of 1,000 have just been employed. Yeah. And we are going to continue to request for empowerment. I also want to say, without fear of contradiction, that Dr. Juan, you must develop a continuous enskillment of the trainers. Because I was asking somebody about the contents of a system, and he assumed that I did not know. Or he said, this is a system. I said, in the system, they are, if it is a phone, there is a relay system there. If it is this, what are the contents? And he assumed that I did not know. If you are going to teach a child to understand so that he can be a properly trained person, you must unmask and tell him or her what the system contains, isn't it? And so on and so on. But the main reason why we came here is to ensure that by the presidential directive, as we are aware, on the 15th of March, all education institutions were closed. What has happened is now history. The unfortunate thing is that COVID is still increasing, but government is going to work as if we are going to open on the 1st of September. And the TVET institutions, as we have looked at them, have a much better chance of survival in terms of getting social distancing. They can tweak and open differently in shifts much more easily than the primary and the secondary school. The big headache we have of masks have been assured by Dr. Juan that they can make their own masks, and I've advised him, because of the indigent children that are doing TVET, even though they are supported by government, they must ensure that they have masks which are reusable. As to whether or not they are going to reopen, as we wait, the first thing that they must do is to ensure the faculty, and that's why the principals are here. It's good that they are here, and I hope they will discuss this. The principals who are the managers themselves must be, and they have told me they are going to get a physician. The person is coming. Yes. There is a physician who is going to come here from the Ministry of Health, and that physician will work with them to carry them through what they must know as principals. Once that is done, they will then go back and get their faculty and non-faculty staff and carry them through what is required. For example, what is running water? It is not getting water in a bowl and everybody washing hands in a bowl. As you wash the corona away with soap, the water should be going somewhere. The myth of liquid soap I want to remove, because Where some people have been saying that it's only liquid soap. That is not correct. I can tell you without fear of contradiction as a physician that soap is soap. Forget about the smell. The smell is an addition. Soap is soap, and the power of the soap which removes the soap has fatty acids, which when you have washed your hands very well and you can see the bubbles coming out, that is the time the fatty acids are destroying the corona. So if you don't have soap, use any soap, but make sure you wash hands for 20 minutes. I think for 20 seconds, and the water should be running. So you must ensure that institutions have water. There are very few. I think you can, and I think the majority of them teach about water and plumbing courses. Then in terms of sanitizers, I'm being told you can manufacture, but be very careful. The alcohol content must be at least 70%. We have seen in the market that there are fake sanitizers already, where the glycerol component is much higher, and therefore it can risk our children. Thermoguns, if you are doing what I expect you to do in the next 2 years, you should be making them yourself. But for now, since we are just caught unawares, perhaps you can buy and ensure that the fever. What happens then when a child is found to be having high fever? I want to ensure that I would want to encourage you to have access. Each of your institutions should have access to a medical facility which is linked to them, so that any child that has fever, for example, should be quickly taken there. The fever can still be as a result of malaria or any other non-lethal viruses. So we don't stigmatize. What would happen if you confirm that the child has corona? I think that one is still in the bakery. We are consulting stakeholders, including the Ministry of Health. And the government will come out with an answer, because then do you close that institution alone, or do you close all of them? We are still working with that one. In terms of, what have I not remembered now? In terms of, we have spoken of flowing water and storage. We have spoken of sanitizers and thermoguns. In terms of preparedness, we have spoken of preparing the faculty. And the issue of the mask, every child and everybody, including the faculty and non-faculty, must wear masks. But I get worried when I visited an institution recently, and about 10% of them were wearing the mask wrong. If you are going to be able you are going to be the one to teach people how to wear a mask, you have to wear it yourself properly first, isn't it? And the most dangerous part is the nose, because it is open 24 hours, isn't it? The mouth only opens occasionally, like now I'm talking. If I wasn't talking, the mouth would not open. But people seem to be very happy to wear the mask covering. And sometimes it is not their fault. That's why those who are manufacturing masks should ensure that it is the correct size and that it fits comfortably. If it's not, and if not, it will utambukiza all the children. Let me start from the bottom. As a physician, I will tell you that according to my training, we should open when we have reached the peak and stabilized and started coming down for 14 days continuously. So that's what's going to determine whether we open or not. I am sure you have a television and you also see and hear in your trade that there is in the world who has dared to open when the COVID pandemic is still going up, and ours is still going up. So that question I cannot answer. We are waiting for what the Ministry of Health says. Let me start by talking about TVET institution. Why did I say they stand a better chance? First of all, even though they do examinations at the same time, most of them, they are not the same. Some, for example, will offer tailoring, some will offer engineering, some will continue to offer what is being offered by universities, which is unfortunate. And so they have capacity, like the universities will have, to decide which aspects to open so that they can create a little bit more social distancing. It's only in that aspect. But as far as boarding houses are concerned, I'm assuming that the majority of the TVET students are day scholars. My friend, you want to ambukisa hiyo mtu. So I was assuming that the majority of TVET students are day scholars. That's one. So if the majority are day scholars, that's an advantage for them. The problem they will have then is in the boarding houses. After they have decided that they want to open, if the cubicle has double decks, they might try single decks. If single decks are not enough, they will then agree what percentage of children they will bring. And they can say, okay, the people doing business, you stay out for 6 months. That is easier said in TVET. How do you do that in primary or secondary? It's easier said in TVET and university. In fact, in my own alma mater, the University of Nairobi, in the Faculty of Arts, they still have that system where a cohort stays, is it for 6 months out?
Yes, 2 semesters, sometimes 1 semester.
2 semesters out, and it is not a big issue. Coming now to the elephant in the room. As far as pre-primary, primary and secondary schools are concerned, social distancing is a major challenge. Do you understand what that means in capital letters? But it should not stop us from preparing to open in September. Reason being, maybe by that time, something may happen and the disease may have been under control. That's one. 2, it will be most unreasonable to expect government to double or triple the facilities of learning institutions, because it has taken years to bring this, to build what is there, isn't it? It has taken years to build what is there. Can government try, for example, to work in shifts? We have worked with the Ministry of Health and we have found out that can work only in grades, primary grades 1 to 3, maybe grades 1 to 4. All the others, not possible. Can government admit only 50%? If it does so, shall we achieve social distancing? The first answer is that it shall not achieve social distancing. And the second answer is it is not possible because it is constitution related. How are you going to select the children who will stay home and the children who will come to school? Can the government change the calendar, for example, so that we start our year in September? The answer is a big no because of the East African Community Protocols. We are a senior member of the East African Community Protocols. It would then mean that His Excellency the President will have to consult with the others. And if they say no, then it will not be something that we should even waste our time about. In terms of teachers, maybe you don't read newspapers, but the government of His Excellency Uhuru Muigai Kenyatta has done very well. Knowing what I know, there's money in the budget for an additional 10,000 interns, and there's also money in the budget for an additional 5,000 permanent teachers. This future will continue as we address the shortage of teachers. You will remember and recollect that the budget of Teachers Service Commission is 266 billion. It's perhaps the single most significant aspect of the budgets, bigger than a ministry. So if you assume that it is under my ministry, then all the other things I do together with the universities and TVET and everything, maybe we end up with about 450 billion or slightly more. So let us not pretend as if we don't know what is on the ground. The money has to come from the taxpayer. And at the moment, the taxpayer base has shrunk, and you understand why. So this problem also requires that you, as members of the Fourth Estate, and everybody else, take part in the solution. So I believe that what the government is doing is the very best. Like we have sampled masks for our children, and I think to produce 24 million masks is going to be several hundred millions of shillings. Should the government not be thinking about that fast, immediately, instead of saying, let's add a few more teachers? So all these are interactive issues that I think the government is very much in control of.